In this video, we are going to study about estimation of age by dental examination. Basically, there are two types of teeth. First, we will have temporary teeth during our childhood. At the age of 6 or 7, these temporary teeth will fall and permanent teeth will erupt. Okay, so basically we should know the total number of temporary teeth that will be present in our mouth at our young age. So there are three types of temporary teeth present in our mouth. So each quadrant will have three types of temporary teeth. They are incisors, canines and molars. So this is central incisor and this is lateral incisor and this is canine. There is no temporary premolar present and there is no temporary third molar present. So there will be this teeth is first molar and this is second molar. Okay. So the totally each quadrant is having 5 teeth. There will be 4 quadrants in our mouth. So 4 5s are 20. Total number of temporary teeth that will be present in our young age is 20. Okay. There is a dental formula that is ICPM. PMM. So this I is incisors, C is canine, PM is premolar and M is molar. Here there will be 2 incisors and 1 canine. So 1 canine, no premolar, so 0, and there will be 2 molars present as temporary teeth. So 2 1 0 2 each quadrant. Okay, 2 1 0 2. This is the dental formula for temporary teeth. Okay, there are some prefix that is used to differentiate the teeth from permanent and temporary. When the teeth is temporary, we should use prefix 5 for right upper quadrant, 6 for right lower quadrant, prefix as 8 for left upper quadrant and prefix 7 for left lower quadrant. This prefix are used only for temporary teeth. For example, let us find out the location of this teeth. So here 6 is used. So it should be an temporary teeth. And the 6 will belong to right lower quadrant. So the teeth is belonging to right lower quadrant and this is 3. That means 1, 2, 3. So right lower quadrant canine. Temporary right lower quadrant canine teeth. Okay. Then coming to the permanent set of teeth. So we will have a total of 32 teeth. Our mouth will have a total of 32 permanent teeth and each quadrant will have 8 teeth. So this is the central incisor, lateral incisor, canine, first premolar, second premolar, first molar, second molar, and this is third molar. So here the prefixes used are 1, 2, 3, 4. 1 for right upper quadrant, 2 for right lower quadrant, 3 for left lower quadrant and 4 for left upper quadrant. For example, let us find out the location of the teeth having this number. 2 means right lower quadrant. 2 means right lower quadrant and 4 is 1, 2, 3, 4. So that is premolar. Here 2 is used, so it should be a permanent teeth. Permanent right lower first premolar. But this thing, if you see this number, this is 6 and 4. 6 means it should be temporary. And 6 belongs to which quadrant? 6 belongs to right lower quadrant. So temporary right lower. 4 means which teeth? 4 means 1, 2, 3, 4. So first molar. So temporary right lower first molar. So the teeth that is present in the right lower quadrant, that is the first molar teeth present in the right lower quadrant of a baby, will have a numbering of 6, 4. Coming to the order of eruption. So there is one order for eruption of tooth. It is not like first incisors are erupted, then canines, then premolar, then molar. That manner is not so. So there is one order of eruption, and this order of eruption is for permanent teeth. So first tooth to erupt is first molar. First molar will erupt at an age of 6 to 7 years. Then central incisors 7 to 8 years. After the eruption of central incisors, lateral incisors will erupt after the fall of that temporary teeth, and that is 8 to 9 years. And after the eruption of lateral incisors, first premolar will erupt, that is around 9 to 10 years. Second premolar eruption will occur at an age of 10 to 11 years, and after that only canines will erupt at an age of 11 to 12 years. And after the eruption of canine, second molar will erupt at an age of 12 to 14 years, and third molar will erupt very lately, and the age range is 17 to 25 years. And here we need to know about one more thing. So let us take, this is the jaw, mandible, and now what happens is, these are the temporary teeth, 2 incisors, 1 canine, and 2 molars. Okay, the first tooth to erupt is, as I told, the first tooth to erupt is first molar. First molar will erupt here. So molars will erupt at the vacant spaces. It will not erupt after the fall of some tooth. So molar will erupt at vacant spaces. So at the innermost part of at the edge of this mandible, at the last part of this mandible, molar, first molar, permanent teeth, first molar, that is permanent first molar eruption will occur. Same way, all the molars will erupt at the vacant spaces. So this temporary molars will fall off, and in place of this temporary molars, permanent premolars will arise. I will explain again. So what happens is, these are the 2 incisors in this quadrant, and these 2 incisors are temporary canine, and temporary molars, 2 molars. So there will be no premolars present as temporary teeth. So there will be some space. In the empty space only, first molar will arise. That is permanent first molar will arise at the vacant space. And after that, as the child grows, second molar and third molar will arise here. Okay. So what happens to this temporary molars? These temporary first and second molars will fall off, and at that place permanent premolars will arise. There will be 2 premolars that will be arising at the place of temporary molars, and this canine fall off, and this temporary canine fall off, and permanent canine will arise at the same place. But here, this temporary molars will fall off, and at that place permanent premolars will arise. Okay, so that is why all permanent molars erupt in vacant spaces. That is why they are called as super added tooth, and remaining all teeth except for this molars, they will arise after the fall of the predecessors. That is the otherwise called as milk tooth. So this predecessors will fall off, and at that place only remaining tooths will erupt, remaining permanent teeth will erupt. So that's why they are called as decidual teeth. Okay, so there is some formula. So here for temporary teeth we will use 5, 6, 7, 8 as prefix, and for permanent teeth we will use as 1, 2, 3, 4 as prefix. Okay, this is normal FDI formula. Modified FDI are using, in here it is in this thing it is continuous manner like 1, 2, 3, 4 or 5, 6, 7, 8. Here it is not so. Here there is discontinuous manner 5, 6 and 7, 8. So let us do some problems. Okay, so here what happens is, here 2, 2, 2, 2, 2. It means 2 is used only when the teeth are permanent. So but here 6 is there. So this teeth is temporary. And it is third tooth, that will be canine, temporary canine. Okay, when will the canine will fall off? Okay, canine will fall off at an age of 11 to 12 years. Here canine didn't fall, so this temporary tooth is still present. So the child's age will be around 10 to 12 years. The child's age will be around 10 to 12 years. Because canine didn't fall, and at the gap of 11 to 12 years only canines will fall off and new canines, permanent canines will erupt. So here the canines did not fall yet, so that the age of the child will be 10 to 12 years. And coming here, this is permanent incisors, permanent central incisor, permanent lateral incisor, permanent canine, permanent first premolar, permanent second premolar, permanent first molar, and permanent second molar. So there is no third permanent molar present. So third permanent molar will arise at an age gap of 12 to 25 years. Here second molar is only erupted. So the age will be the minimum to the maximum. That will be, the age gap will be around, the age of that person will be around in a range of 12 to 25 years. And coming to the third question. Coming to the third question, here this is 6, here 6, it means they are temporary teeth. Temporary central incisor, temporary central incisor, temporary central lateral incisor, temporary canine, temporary first molar. Remember, there won't be any premolar present as temporary tooth. So temporary second molar. Okay, here 2, then it means permanent, and that is 6. So that the vacant space, some permanent tooth is erupting at the innermost part of the jaw. It means that is molar, that is permanent first molar. First permanent molar will arise at the innermost part of the jaw, mandible. Okay, so this is the eruption of first tooth. First tooth eruption will occur at an age of, that is first tooth is first molar, that will erupt at an age of 6. So 6 to minimum to the maximum. So the age of this child will be around 6 to 8 years. Okay, then coming to the last problem, here this is 2 is lateral incisor, and here 2 is present, so permanent lateral incisor. 6 is temporary canine, 6 temporary first molar, temporary second molar, and permanent first molar. Okay, so here one tooth is missing. Okay. At this stage, first molar eruption has occurred. The first tooth to erupt is molar. Second tooth to erupt is central incisor, that is absent here. The child might had trauma, so that the child might lost the tooth. So there should be a central incisor present here, but it is absent. Okay. So then after the eruption of central incisor, lateral incisor will arise, erupt, and after that first premolar have to fall off. First molar, temporary first molar has to fall off, and after the falling of the first molar, that is temporary, first premolar, permanent first premolar will arise, but it is not yet happened. So the age will be around, the fall of the growth of lateral incisors will occur at an age of 8 to 9, and this is eruption of first premolar will occur at an age of 9 to 10. So the minimum to the maximum is 8 to 10 years. The child will have an age range of 8 to 10 years.